Many people have fallen by the wayside, not because of their own, just because of circumstances that have happened. And because of those circumstances, they've fallen on hard times.
There are 61,000 people in North Clark County that have no access to medical care.
If you want to get a perspective of what that's like, 60,000 people, next time you're watching a football game, there's about 80,000 people that sit in those stands. Now take and put this clinic right down in the middle of the field to answer the needs of all those people.
We have kind of a care gap in our country. The wealthy are able to purchase insurance, and the very poor sometimes have access to governmental programs.
This used to be a nursing home, and the church purchased it with the idea that they were going to look to make this an outreach center for the community of Battleground and beyond.
We opened in May of 2011. Battleground Healthcare provides free chronic care medical services to patients in the North Clark County area.
Our parameters are those between 18 and 65, and the reason for that is people under 18 and over 65, there are other insurance healthcare options for them. But those between those ages that are at the 200% of poverty level find themselves having to go to the doctor but having no way to afford it.
We felt that there was a real need in this community for continuity care to provide preventative health services. So we provide general medical care for people with chronic illnesses, such as high blood pressure, high cholesterol, diabetes.
We have patients that may have their insulin, but that they don't have any strips to test their blood sugars. The idea of using insulin without testing your blood sugar is terrifying to me.
To go to a hospital or emergency room for one visit is a horrendous amount of money. And after losing my job and my health insurance, it scared the bejeebies out of me.
We also provide limited dental care, meaning extractions and fillings and cleanings. There are about 72% of the people in Clark County who have not seen a dentist in the last year.
So if I tell a patient, you should eat more apples or you should eat carrots, they're so healthy and so good for you, they say, carrots? I can't chew a carrot. I don't have healthy teeth. I have had rotten teeth for years and I can't afford to go to the dentist. So dental care is going to be huge in our clinic.
There are two great needs in the clinic right now that are facing us. The first one is physicians. We need to be open at least 4 or 5 more nights.
So we have to also have money. So it takes about $75 a visit, takes about $50 for meds, takes about $25 for laboratory testing for one patient. It takes about $5,000 a month now with dental.
For those that we can serve, those that are dealing with chronic conditions, we are here to help them. We want them to know that we will do that in a way that they can walk in and walk out knowing they have their dignity and respect. And we want to know that we're going to serve them as Christ would serve them.
I just want to thank the Battleground Clinic members. They are a big part of my life, and for treating me like a family member. You're gonna make me cry. And
I can't express the joy and thankfulness for what the community has done for Battleground Healthcare.
We are here to help these people with chronic illnesses, help them get better and feel like somebody cares, and we care. The community needs to step forward and let these people know that there is help out there. All they have to do is ask.